Okay, this is Dr. Ezi and the 9th lecture in acute pancreatitis station. These are the questions and answers that you need to know to pass this station in the examination, okay, in the MRCS part B. So today we are going to discuss the questions of the pseudocyst, okay. And most probably the examiner is going to ask you how do you suspect pseudocyst? And pseudocyst is suspected in two ways. The first way is clinical, okay, and the second way is investigations by labs, laboratory, okay. Clinically, the patient will complain of many symptoms that we are going to mention later, okay? And in the labs, you will find a persistent high amylase, okay? The amylase will be always high. It should be low within 48 hours of the beginning of an acute pancreatitis attack, but it will stay high persistently. And this way you can suspect a pseudocyst formation. So now let us go to the other questions about this topic. He's going to ask you about the components, okay. So first of all, it's a collection of an amylase rich fluid, okay. This is the first point. Number two, in the collection you will find some necrotic cells on it, necrotic tissue, sorry, okay. So this is what is inside. This is enclosed inside. Collection of amylase rich fluid and necrotic tissue. This is inside, okay. And it is enveloped by, it is enclosed outside. This is outside here, okay. Let's call this envelope here, okay. In the outside, the wall, there is a wall, and this wall is either fibrous, okay, or granulation tissue. Fine, either fibrous or granulation tissue. It is not epithelium, and this is the reason why it is a pseudocyst. It is not a cyst, it is a pseudocyst. There is no true epithelial wall lining here. It is only fibrous or granulation tissue wall, okay. Well, these are the components inside and outside, okay. He's going to ask you the next question. How long, how does it take till you suspect the pseudocyst, the period? Patient has some symptoms, and you want to say that this may be a pseudocyst. So pseudocyst has something called the rule of 5, okay. The rule of 5. Please keep this in your mind in this station, okay. So when do you suspect the pseudocyst? And actually here the suspicion and the intervention that you are going to do has the same rule of 5, okay. If this cyst or this pseudocyst, this cyst takes more than 5 weeks, or 5 weeks, about 5 weeks or more, okay, or if you find in your investigations, radiological investigations, that its size, the size of it is more than equal or more than 5 centimeters in diameter, or if you find that the wall thickness is equal or more than 5 millimeters, okay, number one, this is the pseudocyst, okay, for the suspicion, and number two, you want to intervene and drain it, okay. This is the general rule, okay. Well, so he will ask you how long till you suspect this. It is 4 weeks and more. It's 5 weeks and more. Both are right. What blood test to suspect? Which blood test? We told you that amylase will stay high. Yeah, okay. And you can do other investigations. You can do bilirubin, for example. It will be high if it is compressing on the CBD. but this is not specific. You want to mention it to get the mark, but amylase is the main one. Okay, well, so what is the presentation? We told you that before. If the patient has a pseudocyst, you want to know that there are clinical, as I mentioned before, and there are laboratory. Laboratory we mentioned already. For the clinical, we are going to mention some symptoms. First of all, the classical symptom is early satiety. Okay, early satiety means that patient is feeling fullness. Okay, fullness. He eats one small amount of food and he gets full. Okay, because his abdominal cavity is full of this cyst. There may be pain, there may be dyspepsia, there may be vomiting. Okay, there may be if it is infected, this patient may have fever also. Okay, but the symptoms of fullness are the most important ones: dyspepsia, vomiting, pain, the gastric swelling outside, and early satiety. Okay, well, so as he's going to ask you about the treatment, the management. What is your management for pseudocyst? Okay, pseudocyst. And the management for pseudocyst, as I told you before, more than 5 weeks, more than 5 centimeter in diameter, more than 5 millimeter wall thickness. In this way you are going to treat it, because it will not resolve. So what are you going to do now? You are going to do something called, number one, we are going to do something called internal drainage. Okay, internal drainage. What is the meaning of internal drainage? Internal drainage, you want to do cyst to something inside. Cyst to something inside. So it is a pseudocyst, so it is a cyst to gastrostomy, so you will drain it in the stomach. Cyst to jejunostomy, drain it in the jejunum. Cyst to jejunostomy in the jejunum, you drain it internally. Okay, so the second thing is that you are going to take a biopsy from the, and they love this actually, biopsy from the wall. Okay, from the wall to exclude malignancy. Okay, so these are the two things that you are going to do. What are the next question? What are the complications? What are the complications of pseudocyst? Okay, number one, you may expect rupture. It's a cyst, so it could rupture. Number one, it could get infected. So infection could occur. Bleeding, if it erodes any other vessel around, splenic vessel, anything, so bleeding inside may occur. And CVD obstruction with jaundice and cholangitis may occur. CVD obstruction and its complications, and as usual in this case, portal vein thrombosis. So rupture could occur, infection, bleeding, CVD obstruction, complications, jaundice, cholangitis, and portal vein thrombosis may occur. Okay, so this is what is related to the pseudocyst in the questions of this station.